Chris, that was very challenging, and I have to say, I don't disagree with anything you say. I think you have summarized the situation as we have it very well. We have the same. My perception is we have the same in the UK. We have a nationalized health service which is underfunded. We have a shortage of doctors and nurses. We have severe rationing of healthcare, such that it is almost impossible to get venous disease treated unless it's active ulceration. And even then, as you quite rightly point out, active venous ulceration is not treated appropriately. I attended a meeting last week, the British Association of Sclerotherapists, where a whole section of the meeting was was devoted to the fact that more and more services are having one-stop clinics where they assess the venous system and they treat the incompetence and the perforators with ultrasound-guided foam sclerotherapy. And as you quite rightly point out, we've known this for some time now. It's been proven by the Everett trial, yet access to that treatment in the UK is virtually non-existent. And we have also seen no uptick in venous referrals or venous treatment following the Everett trial. It's not just phlebology. All access to healthcare in the UK is being restricted, and that is being followed by the private health insurance companies. They also actively reduce the access to treatment. And this concerns me because, Chris, I'm approaching an age now where I'm going to be a consumer of healthcare provision. I've been a provider of healthcare, and at the very point where now I might need some healthcare provision or myself as a consumer, I see reduced spending on healthcare, reduced numbers of doctors, difficult access even to primary care, Chris. So yeah, it's a major problem, and I think the public have not woken up to the tsunami of ill health that's coming. All specialties are advocating. We have under provision of diabetic care. We have under provision of cardiology care. Our accident and emergency departments are understaffed and underfunded. We have very poor access even to emergency provision. So it's a real problem. And I can see that there's going to be great difficulty getting this provision because our economy is in trouble. We have got growth. We've got an aging population. We've got doctors and nurses leaving the health profession in droves because they just see it as rewarding. They don't get the fulfillment of actually providing a quality service. And you're quite right. Certainly in this country, solo practitioners are being picked off by the bigger groups and by the private hospitals themselves. You know, they offer practice privileges, but essentially doctors are working now for big hospitals. So yeah, I take your point, all your points on board. I totally agree with you. I don't have anything to argue with you. I think you're absolutely right. And I think you're an unusual advocate because I don't hear many doctors or nurses actually talking about this problem in the way that you have. I think it's been a very interesting presentation. It's certainly quite shocking. I think we should be shocked by what you've said because it is, as I say, as a person who's entering an age group where I'm going to be a consumer of healthcare, it is very concerning.
Indeed.
When this podcast is published on YouTube, and it also appears on LinkedIn and in your foam sclerotherapy group, I think there'll be one of two responses. There'll either be stony silence because nobody wants to, as you say, be the zebra that leaves the herd and then can be picked off, or there'll be a tsunami of agreement with you. Let's see what happens.
Look, the last thing you want to do, it's easy to point out problems, but there are solutions, okay? And you know, the journey of 1,000 miles begins with the first step. Look, no doubt things are being denied and rationed in your country and elsewhere because of overutilization and non-honest brokers in medicine. You couldn't pay me enough money to be a Medicare practitioner medical director. The NHS does a really good job with all of this. If we venous and lymphatic medicine doctors start to understand and promote venous health like dentistry, it's all over. Because venous disease is like discovering dentistry last year. Okay, dental disease affects about 95%, vein about 75%, vision correction 64%. But are we out there? You know what our toothbrush and floss is in venous medicine? It's compression hose, but I digress. I'm going to stay focused here. But we need to continually hit the drumbeat that venous and lymphatic medicine is like dentistry, and we need to start to do the articles with the patient reported outcomes. It's not difficult, and show that what we do makes a difference instead of all the noise comparing technologies to benefit billion-dollar companies when we know what we do works. And so that's the solution. They're not going to, if you can prove what you do is working, there is a way to make it to be successful. And you combine that with the direct to patient marketing, right? If there's a grassroots among the people of England that we need VeinCare, and here's why we need it, it will happen. That's politics. But if the doctors are the only ones doing it, it won't happen. But you have to get educate the public to become your co-advocate. So there are solutions.
That's the rallying call.
And you're doing it. You're doing it through your video.
I think.
So kudos.
Well, thank you, Chris. That's really kind.
All right.
I think you should. I'm in awe of your advocacy, your energy and enthusiasm. I know how hard you work because I know the time differences in your country when you respond to me, when you're on various platforms. I get the impression, Chris, that you hardly ever sleep.
What?
I think what I'm going to do is
Anyways,
you don't sleep. You're driven in your advocacy, and I have a lot of admiration for what you're doing, Chris. Thank you, Chris. I'm going to wrap that up there. I'm going to say thank you very much. This is going to be a very interesting interview when it's published, and I look forward to hearing what our colleagues make of it. Once again, Chris, thank you very much.
Thank you, Arun. Let's change the world. Have a good day.
Indeed. All right. Take care.